Hi everyone, just not sure we are live already. Yeah, I hope everyone's able to see the screen. So we've got a presentation today about writing a referral letter. So I'm going to go through some of the overview for this letter and how different is writing referral and what are the different types of writing referral. Um, and why are you writing a referral really? Understanding the reason behind it is quite important. It's part of how you are being assessed and how your letter would be constructed as well. Um, so for this tutorial, we've got the writing section. As I've mentioned, you will be asked to interpret different case notes, such as a referral letter, a discharge letter, or maybe a transfer letter. For doctors, majority of the time, it is a referral letter. For nurses, referral or discharge would be quite common. For other professionals, there will be different types of letters that will be common to you. But referral is, the one that is the one that always comes up on the exam. Um, there will always be like normal referral letters, but there will also be instances wherein you will be asked to write an emergency letter or a letter that is simply to update or inform. This type of letters are normally written towards a GP or a family member or carer. And when you are writing your letter, it's quite important that um, that you take into account the age of your patient. So the way that your genre and style changes is dictated by, well, one of the condition is the age of your patient. So always make sure that you are familiar with, who your patient is. So what are the typical things that you need to know? Number one is basically the writing criteria is quite important. Um, you are being judged in terms of whether you're able to write the purpose of the letter. So your performance on the writing subtest is marked independently by two assessors in Melbourne, and neither assessor knows what scores the other person has given you or what scores you have achieved in other subtests. And one of the criterion that they will look at is purpose. The second criterion is content. The next is conciseness and clarity. You've got genre and style, organization and layout, as well as language. The definitions and meanings of all these writing criteria are available on the OET website. They are also available on the SGR website if you wanted to um, understand the criteria a little bit more in order to see how you are being assessed. Um, Now we've mentioned that there are 6 criteria that you will be tested on. Test takers who wants to secure a grade B will need a score of 2 or 3 on purpose. And you should also achieve predominantly scores of about 4 or 5 out of 7 points on the other 5 criteria. Of course, we always tell our students that this is a risky area. Basically, you're looking at about maybe 350, 360 in here. So it's always better to prepare to a grade that is much higher than what you are looking for. So we normally get our students prepared for 3 points under purpose, and move them towards a consistent fives and six within the other criteria. And that's when you really see the improvement within a student. Um, there will be some students whose grammar would be an issue, but as long as their understanding of the case notes, um, their understanding of what is relevant and what's not relevant, and choosing appropriate language as well as vocabularies that are written purposely for that type of letter. Um, and then we always find that the letter is on the stronger side if you don't focus too much on just one criteria. I also get a lot of questions from students with regards to organization. And the common questions are how do I write my letter? Do I start with the patient's information first, or do I start with the consultation today? And I always say that there are no template in terms of how you write the letter. What's most important is that you understand how you are being assessed and you're keeping that in mind. And with the OET writing, always keep the reader in mind. Make sure that your letter is written towards the person that will be reading your letter. So, for example, if they are a medical professional, then medical terminologies would be acceptable. And if you choose information that are relevant to their specialization, so say for example, an endocrinologist, then anything to do with the diabetes would be quite suitable to that. In the same way that if you're writing about the same patient, but this time around, you are writing to a podiatrist, um, then anything to do with the nursing management side or the medical side of it, uh, um, should not be written in too much detail. And with the podiatrist letter, we put a lot of focus on the management of the feet. So every letter should be, written with the reader in mind. So, what type of referral letters will you normally write? The most common one is a referral to a specialist. So this means that this is a GP letter, and the reader will be someone who is a specialist in one particular area. As I've mentioned, it could be a gastroenterologist, an endocrinologist, maybe a surgeon, um, and you're looking for majority of the time you're looking for them to provide further investigation as well as a final diagnosis. So you as a GP would have your initial or preliminary diagnosis, and you will be asking the specialist to confirm whether your diagnosis is right or wrong, um, by doing more investigations in the matter. Another type of letter that you will be writing is a referral letter to an allied health professional. So this is a type of letter that will be written towards, as I mentioned earlier, maybe a podiatrist, maybe a dietitian. Okay, so these are professionals that are there to coordinate with medical professionals in order to help achieve a full healthy condition for your patient. They are also the professionals who provide the specific testing that are not available within the GP surgery or the clinic. Another type of referral letter is an emergency referral. So an emergency referral letter, totally different from a normal referral letter. And this time around, there is an urgency to think about, and also to ensure that you're not writing too much. Majority of the time, the ED staff really don't have the capacity to read a very long letter. So your letter must be summarized properly. It must highlight important information, and preferably not written too long. Some of the considerations that you need to write when writing a referral letter is the age of your patient. So again, your choice of wordings, the way that you greet, or handle the letter is different if the patient is a child, or a young adult, an adult, or an elderly person. So take into consideration the age of your patient as well. And also, lastly, ask yourself, if this letter was not initiated by you and it was requested by someone else, then mention that on your letter as well. And it helps with your conciseness and clarity criteria. So, what is a referral letter? Referral letter is basically an essential means of communication between you, the primary carer, and a secondary carer. So it could be a letter from a GP to a specialist, maybe a hospital doctor back to the GP, maybe a hospital doctor to a nurse, maybe a nurse to a GP or a specialist, or maybe a ward nurse, referring a patient to a community nurse for further care. The aim is to give the receiving clinician or department a detailed summary of your patient's presenting complaint, as well as medical history, to ensure a smooth handover or transition of care. So from your care to their care, your letter is basically the bridge that ensures that this patient will be looked after properly, and as well. So reason for referral, usually because a GP or a nurse will need a specialist's help in deciding the best way to treat the patient's condition. This might also involve referring a patient for tests or investigations that cannot be carried out in a GP surgery. A patient may need to be referred to a particular consultant who has a specialized interest in a particular area. Or perhaps it's the patient themselves, or the patient's family, who had seen a particular consultant previously and would like to see them again. Okay, so always try and understand as well what is the reason why you are, writing a referral letter. So for a referral letter, there are various different types of reasons. Sometimes you will be asking for confirmation of your preliminary diagnosis. So for example, we've got, this is you saying that you need more assessments before diagnosis and you'd like to refer the patient to a memory clinic, and you're going to review after the assessment. On a second patient, this time around, you've made a provisional diagnosis, so gastroesophageal reflux, and your plan is to refer them to a specialist, a gastroenterologist, so that they could provide specialist opinion and endoscopy if required. In other instances, you will need specialist intervention or further management. These are letters that are quite typical for diabetes or hypertensive patients, patients that need long-term care, or require constant medical care. So this could be letter that is written to the specialist at the diabetes unit for further management of sugar levels. Okay, in this instance, a referral to a dietitian for further management of a gluten-free diet. You could also request a very specific treatment or care, such as requesting that the occupational therapies provide wrist splint in this instance. And in this other one, it's basically urgent admission to a psychiatric hospital. So that's an urgent referral in there. So very specific to psychiatry. In other instances, it's not just urgent, but also an emergency. So you're basically writing a referral to the emergency department. Okay. And as I mentioned earlier, it could be at the patient's request. So in this instance, we've got a writing task that says that Mr. O'Reilly has requested advice on low-fat dietary guidelines and healthy, simple recipes. Okay, so these are the type of letters. I'm just going to check if we've got any queries. Hold on a second. Okay, I think we're okay. Just looking to see if you've got any questions or comments. Just let me know. We've also got Tess, our teacher Tess, who will be assisting us today and answer some of your queries. So I'm going to move forward with some more details about a referral letter. So we've discussed that the type of referral letter that you might be asked to write, and also some of the reasons behind it. We'd also like to talk about your role within the letter itself. So if the case note informs that you are a GP, so basically you as a GP provide routine medical care for diagnosing and treating illnesses and injuries, typically the one that doesn't require surgery or specialist intervention. And your job is normally to refer a patient when you want to confirm your diagnosis, and you will refer a patient if they request it as well. And then prior to referral, you will try various tests or treatment options to see whether your patient's condition improves. You make a preliminary diagnosis, you educate and advise. So for a GP to a specialist referral letter, you'd normally see that there are a few things that are quite common to what you do for the patient prior to your plan on referring. So you would notice that you do discussions, okay, with the patient, and that there are treatments that you provide the patient as well. And then right towards the end, you will make your provisional diagnosis. And then after the provisional diagnosis, you will then make a plan to request specialist intervention, and this time around for opinion and endoscopy. And then other than that, you're also giving advice to your patients with regards to coffee and alcohol intake, as well as stopping over-the-counter products and taking a specific medication. So as you can see, as a GP, there are some very common, details that will come up on your case note that that shows the different treatment and medications that you have provided your patient, the different historical consultations that happened prior. And then right towards the end, you will do an assessment and then make your preliminary diagnosis. And then you will have your referral plan towards the end. So if your role is a nurse, okay, a nursing job requires not only treating patients who are sick and injured, but also offering advice and emotional support to patients and their families. You do a lot of paperwork. You help doctors diagnose patients, and you provide advice and follow-up care. So in this particular example, you can see that your case note would show nursing management or medical treatment that you've done for the patient, such as washing the legs, uh, managing the dressings, checking for vital signs, monitoring. You're helping with the bandaging, you're managing that as well. Leg elevation, and also medication compliance. And then towards the end of your case note, you would see that there is a patient's assessment, um, and then you've got your referral plan at the end. So for this particular patient, you've been doing a good job of managing their daily medical needs in the hospital. But even after discharge, your patient requires further care. And this is the reason why you've decided that you need to write a referral letter to another nurse. This time around, it's a community nurse, and requesting them to basically um, help the patient change dressings daily, monitor for infection, healing rate, help with ADLs, and also to monitor medication compliance. So what's really happening here is basically what you were doing in the hospital. This is still required after discharge from the patient or discharge of the patient. Hence the reason why you are writing a referral letter, because another nurse would need to take over your job because you are a hospital nurse. So that's majority of the time the reason why a nurse would write a referral letter. It's because the patient is leaving your care, but still needs further care and assistance uh, you know after leaving the hospital, if you're a hospital nurse, or after leaving the community health center, where you are a community nurse. If your role is a doctor, this time around you are a doctor or one of the doctors in the hospital, your primary job is to diagnose and to treat medical conditions, disorders, diseases, applying your specialist medical knowledge. Okay, hospital doctors treat those who have been admitted or referred to hospital. So you normally see that your referral letter is also, showing discharge plans. It's because your patient is coming from the hospital and will soon be discharged. Um, so in this instance, we've got a sample that you are a pedia doctor, okay? You've been responsible for the care of the patient who's been admitted with abdominal pain. And then within her hospitalization, she was diagnosed with celiac disease. As a doctor, you did several testing, you did several investigations and treatments, and you will see that normally, once you've got treatments and investigations, you will see the results in there, okay? And then right towards the end, okay, you will see the summary of um, of what that result is. So you did a biopsy, what the findings are, whether it's positive, whether it's negative, and then you make your confirmation of the diagnosis. You made an initial diagnosis in here, and the testing confirmed your diagnosis for celiac disease. So now that the patient is ready for discharge, there are additional care that is needed, and this time around it's geared towards the diet. because this is a dietary concern. So your part of your discharge plan is to refer them to a dietitian. But you will see that there are also other plans that will be required or is required for things that you have done already for the patient. So as a hospital doctor, the case note that you were writing would tend to be a discharge plus referral letter. Okay. So what should you write in your letter? I've mentioned earlier that there are referral to specialists, um, referral to an allied health professionals, and these are what we normally call a simple referral letter. You're simply asking for further investigation or further management. So for a simple referral letter, 1 or 2 lines may be adequate to describe the problem, and you need to give a brief introduction of your patient's relevant information, such as their medication, the relevant past medical history, and previous investigations. Um, you might also need to describe their social circumstances, if it is relevant to the patient's discharge, if it is relevant to your reader, and explain their presenting problem as well. So as you can see in this particular example, we've got Mrs. Priya Sharma. She's a type 2 diabetic and she needs further management of her blood sugar level. So this is a very short introduction, but it works because you've introduced who your patient is, you've introduced her current condition, and you've given the reason for writing. You'd like to request further management of very specific the blood sugar level itself. After making your introduction, you can see that this letter goes immediately into giving a bit of a background information about Mrs. Sharma, that she was diagnosed with NIDDM in 1999, the fact that she's been monitoring her BP and sugar levels at home, her family history, her allergy, her weight, and any other personal, social, or medical information will be there. Now that she has been introduced, we are now going to um, start with the chronological information about her diabetes. So you're going to provide information about the initial presentation, what happened then, okay, what are the results, etc. Remember that you're trying not to write every timeline. You know, every time that she came in for a presentation or a consultation, you don't need to write 1 line or 1 paragraph about it. Always make sure that for past consultation information or medical history, that you are basically using your summarization skills and picking and choosing what's relevant to to the condition that she has. So as I've mentioned, you can see that the second paragraph uh, pays particular attention to the blood sugar level itself, which was part of your reason for writing. That was written on the intro. In the first paragraph is all about the patient. Okay, second paragraph starts talking about directly about the blood sugar level condition already. And then once that's been introduced, okay, the patient has been introduced and the condition was given details as well. The next job basically for the letter is to make an introduction about the different types of testing and medication or treatment that was given to this patient during the care of the primary doctor or nurse. So you can see that it's reporting the pathology report results in here, and what the final result is that the cholesterol is high, and then some further details about what was done. So medications given, changes to her medication as well, and results of the BP range and the cholesterol and the non-fasting blood sugar. And this one, the purpose of this one is to show that how a diagnosis was made and how the decision to refer was made as well. What this letter is informing you that because of the concerns on the high blood sugar in here, they have decided to refer for the patient for specialist advice. So it's a very good and logical structure, making an introduction with the reason for writing, introducing the patient, introducing the condition, and then giving details about the primary care that was given to the patient, and then concluding it with how you came about with your decision to make a referral. Um, so when we look at the letter in details, you can see it's organized well. Each idea is connected. So this is the patient and her blood sugar level. We've discussed the patient in here. We've discussed the blood sugar level in here, the different testing and treatment done, and the conclusion part gives you or the reader, a good, concise and clear idea as to why this patient is being referred. Okay. Um, as I mentioned earlier, organization layout is different for every student. There is no particular template. There's no particular way to write a letter. This letter was written in this structure or layout. But also, if you swap the first paragraph and the second paragraph, so now I'm basically presenting the condition first, the blood sugar level first. And then I am presenting the details of the patient first, and still ending with the primary care, medication treatment, and decision making. And that one makes sense to me as well. It's still, although this is the reverse of the other one, the ideas are still connected. This is still talking about the introduction of the patient in here. The second paragraph is still talking about the introduction of the blood sugar level background in here. The only thing that I didn't change are these two because they tend to be at the end because they are conclusion or ideas as to how you came about the decision to refer. So even if one student starts with this one, makes this the second paragraph, or the second student did it in reverse, what's important is that your letter is logical, okay, and that they are well connected in terms of idea. That when the reader is reading your letter, they can understand the story, they can understand your patient very well, they can understand the condition, they can understand what is needed from them, and they can understand what they need to do as well in order to provide continuous care for this specific patient. So the word count for typical normal referral could be about 200, 205, 210. They're normally okay in this instance. They're long, but not too long in that manner. Okay, so we'll talk about the emergency referral. So emergency referrals significantly different from a normal referral letter. Firstly, they are shorter and they're very much to the point. Okay. Secondly, you need to remember that they're always read not just by the person that you're writing, but some of the junior members of the team as well, and other parts of the parts of the ED if you're writing to the emergency department. And this makes it particularly important that you highlight key medical information, key medication and drugs that were given to the patient, and also their social history will be essential in here as well, so that the emergency team has a good understanding of who your patient is and how they can look after them. So in this instance, we've got Emma Johnson, who's got exacerbated asthma. Very quick, thank you for assessing. the letter talks about the family history of asthma present in the mother and the older sister, but other than that, the patient is mm, typically healthy. Okay. And then a very quick introduction about the episode of asthma. When did it first occur? What happened? What was given to her? What were the readings, etc. And then from that point on, it talks about the presentation today, 48-hour history of upper respiratory symptoms and worsening shortness of breath, and the examination details from the doctor, and then the decision making. Okay, how did they decide that this patient requires urgent admission in ED for further investigation or observation and treatment? So as you can see, that the conclusion part is very similar to your normal referral letter. It's always talking about what you did and how you came about your decision. Okay, but the first two paragraphs, they're much shorter. I think we had 4 paragraphs earlier prior to conclusion. In this instance, you will see that you've only got 2 paragraphs. The word count for this one is 178, so it's slightly shorter. You will see that an emergency referral always pretty much summarize, but they're summarized with highlighted information, the information that are very important, information that are very relevant to the reader, okay, what they need to know immediately, so that they can look after your patient afterwards. So there are crucial elements to a referral letter, always making sure that you are clear, that you are concise, especially with emergency referrals. Okay. You need to tailor your letter to the person who will read this. It means that, again, as a reminder, you don't need to memorize different letters and how they are written. Every letter is different. You need to treat every case note, every letter, the way that you will treat a patient. You don't treat them exactly the same, because even though 2 patients might both be asthmatic, one could be an elderly asthma patient, the other one could be a child. So the way that you treat a child would be different from the way that you will treat the elderly. So in the same way that you treat patients differently, you should treat your case notes differently as well, which means that your letter adapts to the different situation. You need to explain why the referral is needed. As you can see right towards the end, the conclusion part of our letter, we're always making an explanation as to how we came about our decision to refer this patient. Okay, you talk about your treatment, talk about investigations, you talk about results. You describe any social circumstances as well, if there's any requirement for it. And you use relevant history investigations, and you highlight other relevant information. If you are unclear of the diagnosis, so this is a referral to request further investigation and definitive diagnosis. Basically, you tell the specialist what you want from them, and you provide your differential diagnosis, meaning if you did an assessment, give details of your assessment, and then make the request for further assessment. Okay, if you've done several testing, you give details of the testing and the result, and then you ask for further investigation. So prior to you asking or requesting from the specialist, always make sure that you're also giving a background information as to the different testing and medication that you did as well. And we've got the advice on patients' ideas, concerns, and expectations, especially for hospital appointment, and explaining if there may be involvement of stress or anxiety in the patient's condition. So if there is an urgent need, okay, and that's why you're referring. If the letter of referral has been requested by the patient, then we need to inform that as well. If your patient is anxious or worried, it would be important for you to discuss that too. If the patient, as I've mentioned, has been requested by the patient themselves or by their family, you can use expressions such as, please see this patient who requests your opinion on, or I am writing to refer this patient upon the family's request. Okay, so some simple phrases would help. Um, know when to ask for help as well. It's good to to be hardworking and studying at home. But if you failed writing a few times, then maybe it's time for you to ask for help. From a professional OET tutor, in order to learn the art of writing a referral letter, not just for for passing your OET writing sub-test, but also because this is especially for doctors, a typical part of your daily life as a GP or as a physician. For nurses, it's quite nice for you to have the knowledge of how to write a referral letter, just in case there comes upon the time that you may need it. Writing a referral letter, not very typical of nurses, but it's a good to know. Okay, anything that improves your understanding, anything that enhances your education, I always say it's very good. So we've proven to help many students pass their OET exam. Those that have taken their exam and passed them back in 2019, majority of them are in the UK already. And those that are already in the UK during that time and passed their exam, they're currently taking or preparing for their plum exam. And for nurses, the ones that we've recently been communicating with, inform us that they've already passed their OSCE and already have their NMC pin and are working as nurses. So it's a good feeling to know that we've been there to help you along the way. And just like them, if you'd like to to seek coaching from SGR as well. We do have a high success rate in writing. Very proud to say, 9 out of 10 of our students pass on their first try, so we get about 90% success rate, and then that one student out of the 10 pass on the second time. Okay, it just means that maybe they need some additional support, maybe they need some additional language support as well. So if you feel that you need further advice and assistance, we currently run several writing tutorials. We do one-to-one writing tutorial. We also provide writing group tutorials on a weekly basis. Our writing tutorials happen and about 2 or 3 times in a week. And they're typically twice or once a week as well, depending on how soon you need the tutorial or the coaching prior to your exam. And for those that require just some guidance as to how to improve their letter, we do provide writing correction service as well. It's a bit more detailed than some of the writing correction service out there. We try to ensure that we're not just checking your grammatical skills, but we're really putting a lot of focus on your purpose, your case note understanding, to ensure that you're writing in a concise and clear manner, to ensure that all the contents that are relevant to the patient's care are included in your letter, and giving you advice in terms of how to choose proper wordings, formal wordings, respectful wordings, Maybe use some softeners if you're not particularly familiar with word softeners, and also give you advice on how to organize and summarize your letter as well. And lastly, as a tutor, we keep track of your improvement. So it's not just a case of sending us a letter and we give it back to you, but we actually keep track of whether you are improving and where your weak areas are and where your strengths are and where you really need to focus to ensure that you are, achieving a grade B on the exam. And the good thing is when you keep track of your improvement, it actually adds to your confidence because you know that previously say if you're 280 and you can see that along the way because of the coaching, because of the writing correction, that you are able to reach 350, 380. And also sometimes our students can't believe that they would reach a 410, jumping from a 280 on the previous exam. And this all comes about because of practice, because of proper guidance, and getting the professional support coming in from your English language tutor. So next week we will be talking about how to write a discharge letter. It would be presented by teacher Tess. Let me just double check if there are any further questions coming in from you guys. I think we're all okay, and hopefully we've given you some additional information about the how to write a referral letter. If you've got any question, just send us a message either on Facebook or WhatsApp. We'll post we'll post a link later on. We'll give you the link as well to the OET exam preparation. As for those that are interested to get to know more about our one-to-one sessions and also to join our group writing sessions, they will be starting we're just about finished with 2 groups. The next writing group will begin on the 11th of May. So you still have 1 week to join our group. And for those that are using our OET discounted group, we do provide further free tutorials for you. So as part of the OET discounted group under SGR, you get a free tutorial for a week, so you can join any of our group sessions within that week. They typically happen at 2 p.m. For listening, reading, and speaking, and at 10 a.m. for writing. Again, if you have any questions about that one or would like further coaching, or would you like to inquire about how to join the discounted group, just send us a message here on Facebook or send us an email. And also you can send us a WhatsApp message as well, okay? So hopefully that's been helpful for you. And again, we will be looking at a discharge letter next week. Thank you very much, and speak to you soon. Bye.